Yeah, it's a great way to kickstart that the women should put themselves first, where a lot of times they're focused on their families, and so now they can focus on their health so that they can provide more for their families and take care of themselves.
So it all started with a chance meeting with Debbie, a physiotherapist, at a diabetes seminar. Since both of us work with groups on health promotion, we were just discussing physical activity programs in the community. A few weeks later, when SADP received a request from Madinah Mosque, I remembered my conversation with Debbie, and I contacted her to see if she could help in any way.
I was attending a diabetes education session and met Sheila through a friend, and we exchanged some emails, and she inquired to me about if I knew any kinesiologists that were interested in doing some physical activity at a mosque she was involved with. So I went to Ananya Banerjee, who works at the cardiac rehab program, and we discussed some opportunities of kinesiologists that she might know that might be able to fit what the mosque was looking for.
I received an email from Debbie, and the 15K challenge announcement had been released from Women's College Hospital. I contacted Dr. Jennifer Price, and given her research on women's health and physical activity and my research in trying to understand how we can implement health promotion programs in religious institutions, we knew that the 15K challenge would be an ideal platform to evaluate an exercise intervention at Madinah Mosque for the women, given their high risk for diabetes.
We first met with the mosque leaders at Flemingdon Health Centre to discuss the project, to see if our ideas of running this intervention for women were feasible and would work, and if they would be at all interested in it and what space would look like. We were then lucky enough to be invited to visit the mosque, and we did our field trip and taking public transportation to see kind of what the neighborhood looked like, what other things surrounded the mosque, and then met with the leaders in the mosque, and were pleasantly surprised to see a beautiful space for exercise. It fit well with what we were thinking of, but also it was really exciting to see how community-based the mosque was and how much they used the mosque during the day.
The South Asian Diabetes Prevention Program, it was started here in 2009. Our main goal is around enhancing equitable access to South Asians around diabetes prevention services and resources. And we're so happy that we can collaborate with Women's College.
So for a very long time, the Masjid has always been a male-dominated area and has never been part of a community and has never incorporated women to the fullest extent. So to have an exercise program in the Masjid for the local women in the area is just a phenomenal thing for them to come by, not just come by for prayer and spiritual and religious purposes, but to also come by for other needs.
So after holding early detection clinics at Madinah Mosque, we went back to Madinah Mosque for a follow-up meeting. And over there we had a discussion about the lack of physical activity in the area, and also since we had screened more women than men, there was also the lack of women exercise programs at the mosque. I then connected with Salim and Suleiman, who got connected with Women's College, and they were glad to know that such women's program will be starting at the mosque that is catered specifically to the woman.
So far it has been a great pleasure to be working with Flemingdon Health Center and the Women's College Center for their continued support, the funding that's coming to us. This has become a very important issue within our community, and hopefully this exercise programs of healthy lifestyle will really be a great influence and a necessity for our ongoing studies.
My contribution to this project is I'm one of the designers of the circuit training exercise program for the pilot project, and we hope we've designed it in a way that the women will really enjoy the exercise program.
We thought it'd be important to do some training with the kinesiologists that we hired for this intervention. So we had them on site, explained to them our thoughts about the physical activity that they were going to start in at the mosque, and showed them some technique of the exercises.
As with religion, it's not just spiritual and religious obligation, it's about the whole body and about health and well-being. So to have this program for the local community, for women specifically, it's just a great thing, and I'm so happy to be part of it.